I started watching this video with the Department of Defense and I thought, oh man, the bride needs to see this. We need to watch this together and do an evaluation, just like I do with the presidential candidates. Okay, so let's watch them and see what they're going to say. They are going to give us their strategic plan on the vaccine. Okay? So let's see what the Department of Defense is going to do about their vaccine plans.
We're on the phone this morning. As we promised about 2 weeks ago that we would be giving you regular updates on our COVID response and vaccine distribution plans, that's what we're here to do today. With me this morning are Tom McCaffrey, the Assistant Secretary of Defense for Health Affairs, and Lieutenant General Ronald Place, Director of the Defense Health Agency. Mr. McCaffrey and General Place will be providing key insights to our COVID-19 vaccination and prioritization plan in just a moment. As many of you know, the Department of Defense has long been planning a phased, standardized, and coordinated strategy for prioritizing, distributing, and administering COVID-19 vaccines to protect our people, maintain readiness, and support the national COVID-19 response. We're going to cover 5 specific pieces of information that are of importance to the force and the public: the size of the initial DoD allocation, the prioritization schema for the populations to receive the vaccine first, our priority plan phases for the distribution, the locations of the initial vaccine distributions and the general allocations, and the timeline for initial distribution and next phases of the distribution and vaccinations.
They're going to tell us a lot, Brad.
We've provided you all with the slides in advance, as well as our press release. There should be useful documents to follow along with. I will note that a lot of work has gone into the planning of the distribution of this vaccine, which in itself is a remarkable feat. I ask that as each of you shares this information, keep in mind that our goal is to be transparent with the force about what is happening and to encourage our personnel to use the vaccine. We're fortunate that DoD has weathered the COVID storm better than most, and that is reflected in our allocation and how we are prioritizing our initial doses. We look forward to being able to help the country get through the coming weeks and months as the vaccine is distributed and becomes more prevalent in our communities. So with that, I'll turn the podium over to Mr. McCaffrey.
Thank you, Jonathan, and good morning, everybody. And we appreciate the opportunity to highlight the department's plan for the delivery of COVID-19 vaccine. The department's priorities, as you know, are protecting our service members, our civilian employees and families, safeguarding our national security capabilities, and supporting the whole of government response to the COVID-19 pandemic. As such, and as we'll outline today, our plan will provide the COVID-19 vaccine to DoD uniformed service members, both active and selective reserve components, including members of the National Guard, dependents, retirees, civilian employees, and select DoD contract personnel as authorized in accordance with DoD policy on this topic. I am extremely confident the department's plan, developed in collaboration with Operation Warp Speed and the CDC, provides a very clear roadmap to protect our entire DoD population across the globe against the pandemic. Early in the COVID-19 vaccination program, there will be a finite supply of vaccine. Vaccination distribution prioritization with DoD will be consistent with data-driven CDC guidance for national prioritization. In the coming days, we expect the department to receive its first allotment of the vaccine. Initial phases of the DoD distribution and administration plan are based on the expected limited number of initial vaccine doses allocated by Health and Human Services in the CDC to DoD, and on the department's need to rapidly validate our processes to support increased distribution as vaccine production increases. At this time, DoD is expected to receive just under 44,000 doses of the Pfizer vaccine as early as next week for immediate use. DoD's plan for distributing this vaccine includes monitoring processes to inform senior leader decisions about distribution capacity, increased distribution at administration locations, and our force health protection. Our deliberate and phased approach to distribute and administer this first allotment in future allocations of the COVID-19 vaccine will focus on vaccinating priority populations quickly and safely, while simultaneously refining the intricate planning for the delivery of larger volumes of vaccine in future waves.
Future
The department will
waves.
prioritize DoD personnel to receive the vaccine based on the CDC guidance and on the department's own COVID task force assessment of unique mission requirements. The DoD prioritization plan is consistent with CDC guidance and prioritizes healthcare providers and support personnel, residents and staff of DoD long-term care facilities, other essential workers, and high-risk beneficiaries to receive the vaccine before other members of the healthy DoD population. As mentioned, the DoD plan calls for a phased approach. The initial phase is what we are calling a controlled pilot. In this phase, we will be distributing the vaccine to priority populations in 16 distinct locations. We will monitor the uptake and make adjustments to our plans going forward as necessary and as lessons learned.
Pause. 16 distinct locations. Where do you think those locations are? I'm just guessing. But I'm guessing we have 4 states. 4 times 4 is 16. So maybe on the north, south, east, and west of the 4 states, which is Florida, Tennessee, Texas, and Louisiana. And it just so happens that as 4 states are in the South, in the Bible Belt, with a lot of evangelicals. Just my opinion, of course.
From this controlled pilot. We will continue with this form of distribution, adding additional prioritized personnel and additional prioritized locations until 60% of our DoD, roughly 11 million personnel, have received the vaccine, at which time DoD anticipates vaccine manufacturing rates to support full-scale, unrestricted vaccine distribution to department personnel. At that point, our intent is to distribute the vaccine in the same manner the department conducts its annual influenza vaccine program. If you look at some of the slides we provided, the department selected initial vaccine distribution sites to best support several criteria. Number one, the anticipated unique supply chain requirements for the initially approved vaccines, a sizable local DoD population with priority personnel across all the military services, and sufficient medical personnel to administer the vaccines and monitor recipients after initial and second dose administration. In his remarks, General Place will provide additional details.
All right, wait a minute. What did he say about administering the vaccine? Let me rewind.
If you look at some of the slides we provided, the department selected initial vaccine distribution sites to best support several criteria. Number one, the anticipated unique supply chain requirements for the initially approved vaccines, a sizable local DoD population with priority personnel across all the military services, and sufficient medical personnel to administer the vaccines and monitor recipients after initial
sufficient
and second
medical
dose
personnel.
In his remarks, General Place will provide additional detail on those specific locations. In a recent virtual tabletop exercise led by Deputy Secretary of Defense and senior civilian and military leaders, the DoD COVID Task Force and the leaders responsible for the first phase of the plan walked through the processes in great detail to ensure seamless distribution and dissemination of this initial wave of vaccine across our selected sites.
Do y'all hear his language? Initial wave. Is this not the second time in his speech we have heard the term wave? Bride, these are the things that we need to pay attention to. Okay? So, they're calling these waves, huh? The initial wave. All right, let's pay attention.
The lessons learned from this exercise help solidify the
This exercise?
department's plan on the way forward. In terms of next steps, as soon as the FDA issues an emergency use authorization, DoD's allocation will be pre-positioned at our initial locations. Upon issuance of the EUA, the CDC's Advisory Committee on Immunization Practices will meet, review the EUA, and then vote to recommend the vaccine and how it should be disseminated and who should receive it. We expect to have
Now, can you believe they're saying that after they get the emergency use authorization, then they're going to decide who gets it? Baloney. Baloney. They have already been discussing this. Remember the vaccine congress that we watched at our office? They already know who they're giving it to first.
and arms of DoD personnel within 20 to 48 hours from the time the ACIP issues its final recommendation. I want to personally thank the men and women across the department who have spent countless hours, both day and night, supporting the development of this plan. Their preparation for the vaccine of millions of individuals across the department in the coming weeks and months will protect our force against COVID-19 and allow us to continue to fulfill our mission to the nation. General Place and I look forward to answering your questions.
Good morning. Thank you, Honorable McCaffrey. Our country and our forces should be assured that the Department of Defense is ready to execute a global COVID vaccination plan for our service members as well as military families, retirees, and certain government civilian and contract staff. Following approval by the Food and Drug Administration and guidelines from the Centers for Disease Control and Prevention, the Defense Health Agency will lead a department-wide phased effort to distribute and administer the vaccine. While we await final approval from the FDA, the preliminary data on the safety and effectiveness of the two vaccine candidates is highly encouraging. We're recommending that everyone take the vaccine when it becomes available to protect yourselves, your families, your shipmates, your wingmen, your battle buddies, and your communities. As with most vaccines, some people may experience small adverse effects: arm soreness, fatigue, even a fever. The department will be fully transparent about any adverse effects that are reported and share this information with the CDC. Now, as Honorable McCaffrey mentioned, as we begin our vaccination process, the department specifically chose 16 locations, 13 in the United States and 3 abroad. We selected these locations based on our desire to validate our plan. As such, we chose locations with extra cold storage capability, sizable local populations to vaccinate, and medical staff large enough to administer it. We chose locations from each of the military services, including active and reserve components, along with the United States Coast Guard. Finally, we chose locations with an on-site immunization health specialist. As Mr. McCaffrey noted, the good news is that our military medical teams have worked for months to prepare for this moment, and we're eager to begin to deliver on Operation Warp Speed's promise. The Department of Defense has decades of experience with conducting global vaccine programs, whether it's the annual flu campaigns or protection. And we have systems in place to monitor the health of everyone who receives a vaccine.
But
In terms of the next steps, following FDA approval, the department will receive and begin vaccinations of our high-priority populations this month. We've identified the military installations and the military treatment facilities that will receive the initial shipments of the approved vaccines, as Mr. McCaffrey noted. We've initiated our staff training protocols for vaccine administration and working closely with our TRICARE network providers and pharmacies to prepare for wider scale vaccinations as the vaccine supply expands. This phased approach to vaccination will take time. We recommend that everyone continue to follow the latest CDC guidelines to include physical distancing, hand washing, and wearing face coverings when appropriate. This has been a challenging year for all Americans, and I'm inspired by the perseverance and commitment of the men and women of the department and the military health system. Together, we're working as a team to protect all entrusted to our care. Thank you.
All right, thank you. We'll go to the phones. I don't know if Lita jumped on from AP. Lita? All right, so we'll go into the room. Barbara.
question is for the general. I wanted to ask on the medical side of this, sir. Could you explain as much as you can about what part of this vaccination program will be voluntary, what part will be mandatory?
Right.
Just as much detail as you can, and especially for high priority categories, for deploying units, for senior leaders. Can you walk us through some of that?
Yes, ma'am. We anticipate that this will be approved using emergency use authorization, not a fully licensed FDA vaccination. And as such, the department's policy will be voluntary for everyone. So there's no ifs, ands, or buts about it. Doesn't matter. Voluntary for everyone.
All right.
Does it? I just don't know how this all works. So it starts with emergency use authorization. The vaccination is voluntary for everyone, including deploying units, including high priority units.
Wow.
Does it eventually in some way shift to mandatory once there's full FDA licensure? And how will that on a practical level work? For example, for special operations forces, small units, strategic units, deploying as on a team level if some people don't get it, don't take the vaccine.
Well, I don't know if Honorable McCaffrey wants to talk to the full licensure aspect and potential for future. The department is strongly encouraging everyone to take it. And the reason for that, if you look at the data that are available to all of us now, that Pfizer, at least the one vendor, has made available to everyone, if you look at the safety profile of it, the safety profile is very good. And the efficacy of the vaccine, again, short time period, appears to be very good. So in a risk stratification, my advice as a physician is that if everything we do in life, every medication that we take, every surgical procedure that we have is all about risk. And the risk of this or these vaccines, from what we know, is much less than the risk of the actual disease process. So our advice to everyone, on a volunteer basis, our advice to everyone is to take the vaccine, just based on risk.
See, Tom?
Making it mandatory.
Well, that's, I think Tom will
So on that question, I think as General Place indicated, this would be the normal process when a vaccine is first issued under emergency use authorization. It's typically on a voluntary basis, so we're going to be consistent with that. As it moves, as FDA looks at the experience of the vaccine, real experience that we're seeing in the population, and they ultimately, assuming they ultimately grant full licensure, at that point, the department would look at that, and based upon, again, risks and benefits, and look at unique requirements from the military departments, from the combatant commands, would make a determination if we believe for military readiness, we should consider, making a fully licensed COVID vaccine mandatory.
Wow.
But there's a process that we use based upon data, based upon the FDA's
Wow.
assessment. But I think the other question you raised was, in this interim period where, not all the force is going to be vaccinated in the next month or two, the department's very clear in all of our policy. Everything that we have in place right now in terms of our standard mandatory force health protection guidance, in terms of public health mitigation, social distancing, testing before deployments, that will all continue. Even as we, in the early stages of the vaccination effort, we're going to continue all those measures. We have to, because not the entire force, both active duty and civilian, are going to be
So there you have it, Bride. There you have it. When the FDA gives their final approval, that's when they can turn around and make it mandatory. And I will tell you from the Vaccine Congress, that is what they said will have to happen. But it will be close to the end, like in the spring when they have more volume of the vaccine.